Hi, my name's Madison Taylor, and today I'm going to talk about heart murmurs. A heart murmur is a whooshing or swishing sound heard through a stethoscope when blood flows abnormally over your heart valves. Heart murmurs are common and don't always indicate a health problem or issue, especially in children. However, heart murmurs should still be evaluated further to rule out a heart problem or other health issue. Murmurs can be congenital, meaning present at birth, or acquired, meaning developed later in life. Innocent murmurs occur when blood is flowing more rapidly than normal and can be caused by childhood, exercise, growth spurts, pregnancy, and can occur the first few days after a baby is born. A worrisome murmur can occur when the heart fills with blood or throughout the heartbeat. This can be indicative of a more serious heart problem and should be monitored closely by a healthcare provider. The risk of heart murmurs in babies is increased by family history of heart problems linked to murmurs, uncontrolled diabetes in the mother during pregnancy, rubella in the mother during pregnancy, and use of certain medications, alcohol, or illegal drugs by the mother during pregnancy. Medical conditions that can increase the risk of murmurs in adults include carcinoid syndrome, cardiomyopathy, endocarditis, anemia, hypereosinophilic syndrome, autoimmune disorders such as lupus or rheumatoid arthritis, heart valve disease, pulmonary hypertension, history of rheumatic fever, and hyperthyroidism. Essential questions to ask the patient during their workup include: have you experienced any fainting, chest pain, leg swelling, skin color changes, or shortness of breath? These symptoms are important to identify because they can indicate a worrisome heart murmur. Have you ever been diagnosed with hyperthyroidism? This is important to ask because hyperthyroidism is often linked to heart murmurs. Does anyone in your family have a heart murmur or a heart valve problem? This is important to ask because a family history of heart problems linked to heart murmurs increases the patient's risk of having a heart murmur as well. During the physical exam of the patient, when listening to the heart with a stethoscope, if you hear a murmur, you should note the volume, location, pitch, timing of the murmur, and sound changes. This helps determine if the murmur is innocent or worrisome. The timing of the murmur is a key component. A murmur that occurs when blood leaves the heart is a systolic murmur and is generally an innocent murmur. A murmur that occurs when the heart fills with blood is a diastolic murmur and may signal a heart problem. A murmur that occurs throughout the heartbeat is a continuous murmur and may also signal a heart problem. Bluish skin may indicate a worrisome heart murmur, and heart palpitations may also indicate a worrisome heart murmur. Innocent heart murmurs do not usually need treatment. Treatment for a worrisome heart murmur depends on the cause. A worrisome heart murmur requires close monitoring by the healthcare provider and may require medications or surgery. Medications that may be used to treat heart conditions associated with murmurs include anticoagulants, diuretics, ACE inhibitors, and beta blockers. There are a few priority teaching components that must be addressed with the patient to manage their diagnosis. This includes: if you have ever been diagnosed with a murmur and have been told by your provider that a heart problem or other condition is causing your murmur, that problem will need to be treated. If you have ever been diagnosed with a heart murmur and you start to feel tired or having trouble exercising or being physically active, or you're experiencing chest pain, notify your provider immediately. And for the pediatric population, if your child has been diagnosed with a heart murmur and starts to have rapid breathing, difficulty breathing, or blue tint to the lips, notify your child's provider immediately, as these could be signs of a more serious problem. Thank you.